Does ethnicity play a role in the incidence and prevalence of multiple sclerosis, or MS, if vascular risk factors are similar? This is a question that has intrigued scientists and medical professionals alike for years. Multiple sclerosis is a potentially disabling disease of the brain and spinal cord, where the immune system attacks the protective sheath that covers nerve fibers, causing communication problems between your brain and the rest of your body. The disease can cause the nerves themselves to deteriorate or become permanently damaged, and its symptoms vary widely. The hypothesis is that even if vascular risk factors are similar, ethnicity alone does influence the incidence of MS. To test this theory, data were collected over a span of 27 years, from 1990 to 2017. The data were sourced from various databases and included both Caucasian and non-Caucasian individuals between 15 to 45 years old who were diagnosed with MS. The individuals also had similar vascular risk factors, including hypertension, hypercholesterolemia, diabetes, a body mass index over 30, heart disease, and smoking habits. The incidence rates between the two cohorts were calculated using Poisson regression, and data were also collected to reflect any influence of gender. Multiple sclerosis is thought to be predominantly an autoimmune disease. Several studies have reported increased cardiovascular morbidity in MS patients, and that vascular comorbidity at any time during the disease course could increase the risk of progressive disability. It has been established that African Americans have a higher risk of MS. But what remains unclear is if ethnicity is the sole risk factor that drives MS risk in the young. No study until now has sought to understand the role of ethnicity in the genesis of MS, if the effect of vascular risk factors is nullified. The implications of these findings are profound. They could potentially change the way MS is diagnosed and treated. It could lead to the development of targeted therapies for different ethnic groups, potentially improving outcomes and quality of life for many people living with this debilitating disease. In conclusion, the role of ethnicity in the incidence and prevalence of MS is a complex and multifaceted issue. It is clear that more research is needed to fully understand the intricacies of this relationship and how it can be used to better manage and treat this condition.